I chose to focus on the ethics of refusal of cochlear implants for deaf children. I wanted to start by explaining what a cochlear implant does. A cochlear implant is a small electronic device that electrically stimulates the cochlear nerve. It has an internal and external part. The external part sits on the backside of the ear and has a microphone that picks up sounds, transferring that sound to the internal part of the device. The internal part is placed under the skin right behind the ear. A thin wire and small electrodes lead to the cochlea, which is part of the inner ear. The wire sends signals to the cochlear nerve, which sends sound information to the brain. Although normal hearing is not restored with appropriate therapy and practice, the improved hearing experience can mean an increased awareness of sounds in the environment, as well as better communication through easier lip reading and listening. This sounds like amazing technology, but many people actually refuse this treatment for their children, and I wanted to dive more into the ethics behind this. This case raises significant questions concerning whether hearing rehabilitation should be mandated and if there are circumstances in which parental preferences should be questioned or overridden with regards to this issue. This brings up the question of denying autonomy and whose autonomy is in fact violated. I also wanted to consider whether the hearing ability of the parents should be considered when analyzing the ethics of this study. I wanted to apply 4 main ethical principles to this issue: justice, autonomy, non-maleficence, and beneficence. I chose to apply this to a case online I found regarding parents denying hearing aids of any kind to their children. 2 young brothers present with severe to profound congenital sensorineural hearing loss. The parents, both of whom have normal hearings and work as sign language interpreters, have decided to raise their children with ASL as their only form of communication. They have chosen not to pursue cochlear implants nor support the use of hearing aids. In this case, the parents have the ability to hear. They want their children to grow up a larger part of the deaf community and to have that support to lean on. However, a lack of hearing is considered a disability. This makes me believe that paternalism may be acceptable because it could be argued that the ability to be involved with the deaf community is not enough to not provide children with hearing rehabilitation. This brings up the issue of giving your child a minimally satisfying life. Although it would be wrong to say that people who are deaf do not have minimally satisfying lives, or that preventing medical rehabilitation for hearing loss applies theories of maleficence, I think an ethical question can come up whether or not it is wrong to give treatment when it's available. Crouch, in Letting the Deaf Be Deaf, makes 2 main arguments about the use of cochlear implants in prelinguistically deaf children. These are the fact that cochlear implants often fail to achieve the objective of enabling the child to not only merely hear sound but to perceive speech well enough to be able to produce intelligible speech themselves. Second is that even if the technological limitations are overcome, a decision to forego cochlear implants for one child does not allow them to be a part of the deaf community, a unique community with a rich history, a rich language, and a value system of its own. Tucker, however, in Deaf Culture, Cochlear Implants, and Elective Disability, also addresses the claim that receiving cochlear implants represents a threat to the deaf culture by enabling partial hearing. The deaf community understands deafness as a cultural identity rather than a disability. He, as a deaf person, does not agree with this point of view, stating that the inability to hear is genuinely disadvantageous, and the ability to hear, even if it is only partially, allows the deaf child more opportunities than knowing ASL only would allow. I wanted to apply to this case the possible violation of autonomy and the ability to choose your preferred course of treatment. I think that this is very similar to the vaccination nudge article we discussed in class because I don't believe that it is in fact the patient's autonomy that is violated, since this usually occurs in very early childhood, typically before age 3. I think it is the parent's autonomy that would be compromised by pushing to have cochlear implants in children who are deaf. I think you also must consider whether the parents of the child are deaf themselves, because that can play a large role in the parent's decision-making. By being deaf, the parents may feel more disconnected to a child who has a cochlear implant and may worry that the cochlear implant would make them unable to be a part of the deaf community. But I don't believe that this is enough to deter them from getting treatment if it is accessible, because the ability to hear opens you up to more opportunities. I think this could cause more of an issue between the parent-child relationship, which can be overcome in many other ways. I think it could be argued that the doctors are obligated to apply beneficence to the patients they are treating, and advocating for hearing rehabilitation falls under that. I think although parental autonomy could possibly be compromised, it may be okay due to the well-being of the patient, since they are not at an age where they can choose their own care. Overall, I think that in our current healthcare system, there are very few things that should be prioritized over patient autonomy. But in this case, I think that the ability to live a life with more opportunities outweigh the potential loss of parental autonomy.
tried to make it